Okay, today we're going to talk about Alzheimer's disease. Alzheimer's disease is when a patient loses touch with life. They are no longer able to remember things and they become unfamiliar with very familiar places. They depend on a caregiver to deal with daily life routines. They are adults, but you have to treat them like if they were babies. Many people wonder what causes Alzheimer's, what are the signs and symptoms, and is there any ways to prevent getting Alzheimer's disease? Well, today we're going to talk about three main points. We're going to talk about what causes Alzheimer's disease. I'm going to tell you about some signs and symptoms, and I'm going to give you some ways to help prevent Alzheimer's. There's two ways you can get Alzheimer's disease. One is hereditary, and it is given to you through your genes, and it is called familial Alzheimer's disease. The second one is called sporadic Alzheimer's disease, which is the most common, but it is very unpredictable. In the first stages of Alzheimer's disease, patients start to lose touch with life little by little. They can be walking around and trying to find their way back home, and they can't remember how to get home. They might forget people's names. And the middle stage, well, here's a picture of the first stage of Alzheimer's disease. The blue part is the disease, and it's traveling through your brain slowly. And then the middle stage of Alzheimer's disease is when it starts to get more serious. They start to forget who their family members are. You can be their son, you can be their daughter, their cousin, their best friend. It doesn't matter.
What about their cat?
Yes, you can be their cat. They're not going to remember who you are. Okay? For example, my grandfather died of Alzheimer's disease. It was very hard. There was days where he would remember who you were, and the next day he didn't know who you were. You could sit there and talk to him and tell them, how's your day been, and, I love you, and they don't know how to react to it. They think of you as a complete stranger. And it is very hard, and you don't want nobody to experience that. They are still able to eat on their own when they're in the middle stage of Alzheimer's disease. And as you can see right here, it is traveling a little more through your brain, but your brain is still able to function, and it's still able to tell your body, how to still do things. Now, when you get to the late stage of Alzheimer's disease is whenever the caregiver has to treat the patient like a baby. They cannot eat on their own. You have to bathe them. You have to feed them. You have to constantly be on top of them, making sure they don't get into things they're not supposed to get into. They can harm themselves without even knowing. And as you can see right here, the whole brain is covered in the disease, which it doesn't let the brain tell the body what to do, so they can't function. And they're helpless, and you have to treat them like babies.
Well, why do you have to treat them like babies?
Because whenever you're a baby and when you come into this world, you don't know what to do. You don't know what to expect of life. So as you get older and you get this disease, then you have to treat them like a baby. You have to show them their way. They don't know how to do things. Anything else you may want to ask me?
No.
Okay. Some ways to help prevent Alzheimer's disease is by doing daily exercises, taking walks, 30 minutes to an hour. It helps keep your mind active. You can do some puzzle games, just some word games, anything that keeps your mind functioning, even conversating with somebody, asking them how your day was, how you've been, tell me something about your life. It helps them keep going, and their brain doesn't stop. It's constantly just going and going and going. It's thinking. Okay. So that's Alzheimer's disease, and you need to take it very serious. So whenever you leave here, keep this information with you. Now you know the signs, the symptoms, and you know some ways to help prevent it. So now you can take this home and tell somebody else, to try to help prevent Alzheimer's disease. Is there any questions that you may want to ask?
Do you have Alzheimer's?
Sometimes I think I do have Alzheimer's because I forget things constantly, but I hope I don't.
Have you got it checked?
No, I have not. I'm still very young.
That doesn't matter.
It is not known to have Alzheimer's disease in your early 20s, but I will go get it checked out. Anything else? Thank you.